Glaucoma today is actually the #1 cause of irreversible bilateral blindness in the world. Traditionally, we've thought of glaucoma as a disease of an elevated pressure in the eye, but today we have a slightly different view of it. It's really an optic neuropathy of which the certain level of pressure is the most common causative risk factor, but there are many other causes, and today we're looking at other ways of protecting the nerve in addition to lowering the pressure, neuroprotective agents. There are basically three things that we look for. The pressure is still important, even though some people can have glaucoma with normal pressures. There's a condition called normal tension glaucoma. The other two areas we look at is the optic nerve, because that's where we see the optic neuropathy. And today we do have diagnostic image analysis ways of analyzing that. And then the third thing is the visual field, because the optic neuropathy obviously causes loss of vision. And it starts out in the mid-periphery, so the patient may have no idea that they're losing sight because it's in an area that they don't recognize early on, and it has to be done with a field test to find it. We have three therapeutic approaches: medical, laser, and incisional surgery. In the majority of cases, we start out with medications. These are virtually all in the form of eye drops. We have a few pills, but mostly eye drops. There are four classes we use commonly today: the prostaglandins, the beta blockers, the alpha-2 agonists, and the carbonic anhydrase inhibitors. And in some patients, we actually have a person on all four of those classes. And when we get to the point where we can no longer control the pressure medically, then we usually turn to one of the laser procedures. And when that fails, why, then we go to the incisional surgery.